Wamego City Hospital, Wamego, Kansas. Shannon, congratulations. You've been named our Health Care Organization of the Month for August 2012. And I'm just thrilled. Well, first of all, I like Kansas. My grandfather was from Kansas, Swanee, Kansas, so I'm sort of excited about that. He worked for Missouri Pacific Railroad there. So it's sort of always had a little bit of a deal here for Kansas. So congratulations. I've got even a bigger deal for the results that you've been able to accomplish, which are truly just absolutely amazing. And it's got to feel good, because when you look at when we provide this award, it's so hard to win. We've had organizations that have won the Baldrige Award, which have now become our Organization of the Month. We've had organizations that have won and been designated, the Magnet designation and have not really won this award. We've had organizations been named Best Places to Work, haven't won this award. Now, have we had some that have won all of them? Yes, but many of them don't. Why? Because we believe that this award has to really represent great patient care, but also great places for employees to work, physicians to practice medicine. And it's those organizations that really now walk the talk, or have always walked the talk. So let's go back to your mission statement and why one of the reasons I think your values did not allow you to do anything but create this accountable, consistent, highly reliable organization that you have become at Wamego City Hospital. It's very similar to our mission statement, and I think that's why I think it's been a good partnership. At least we believe it has been, and we're grateful for it. Our goal is to make healthcare better for employees to work, physicians to practice medicine, and patients' families to receive care. So it's very clear it ties into that delivery of high-quality health care that you talk about in a compassionate way. Well, let's talk like outcomes. So think of how you've done and you've reduced your variance. Because when you look at pain management, you were in the 67th percentile in 2008. And what that meant was really you were a little bit above average. That meant some patients probably felt you managed their pain very well. Some probably said okay, and some probably said, hey, they didn't do a very good job. You are now in the top 2 percentile of organizations across the country in the area of pain management. This is really important because it also does things like reduce falls. It's interesting because when research shows why people fall out of a bed, it's because they're in pain and they're moving around. So you've done that. He's also reduced call lights, because when do people hit the call light? When they're in pain. We also know when you're in pain, nothing else looks good. The heat doesn't look good, or the temperature doesn't look good. Nothing seems to fit. So I'm just amazed at this. In fact, I'm sitting here thinking, if every organization in the country could learn from you, wouldn't patient care be so much better? Your overall rating went from the 75th percentile to the 92nd percentile. And this really sort of fits the organizations we work with. People ask me many times at the Studer Group, do you do a lot of turnarounds? Well, we do some turnarounds, but most of the time we don't. Most of the time we work with organizations that have come a long, long way, but they just can't get the last part of it, which means they can't tighten up that last piece of accountability, that last piece of consistency, can't reduce variance to the point that they get that consistency and that reliability. And that's, of course, why we look at the evidence-based leadership model. We look at the evaluation tools, the training and development of leaders and staff, making sure we sort of talk about what is mandatory behavior, making sure the processes that have been improved upon can actually be implemented or executed, and then, of course, having those performance management discussions to make sure that everybody understands what needs to be done to be successful. Another area that you're just remarkable is your communication of medications. Again, most organizations would have taken an 88th, but not you. You want to even get better, and you're in the 92nd percentile. And see, what you've done is so much harder than going from the 10th to the 70th, because you're basically now being compared to other great organizations that have this on their to-do list, that pay a lot of attention to this. So it's really been remarkable what you've been able to accomplish. Your responsiveness to staff in the 98th percentile, it's truly remarkable. In October at our national meeting on What's Right in Healthcare, there's going to be so many people that are going to be interested in talking to you, because the type of results you have are so stellar. They're going to be going to those organizations and trying to say, how do you do it? How have you done it? How have you created that consistency? And because that's really what organizations are looking for. And look at your turnover. you've decreased your turnover from 39 percentile to 8 percentile. Now, many people might say, well, gee, that's just remarkable, and that's wonderful for all sorts of reasons. Lower cost of orientation, again, more consistency. But let me give you another thing. According to the Voluntary Health Care Organization and University of Alabama Birmingham study on employee engagement, by lowering your turnover, you've improved patient care. Both mortality index goes down with the lower turnover, and patient safety goes up with lower turnover. You've been a two-time recipient of Modern Healthcare's Best Places to Work. You've maintained an 8% better operating margin for the last 4 years. Now that's truly, truly remarkable, because let me explain, the average in the United States of America margin is 2.2%. And Shannon, thank you for sitting in on our Rural CEO panel in our April TYYO. So it's truly remarkable what you've been able to accomplish in Kansas. So what happens next? Well, you get a crystal flame. This flame ignites a fire, a flame, because in early civilization, what we found is that people needed a certain flame to cook, to stay warm. If that flame wasn't there, it would go out. They'd even transfer the flame in embers from one village to the other village, or when they would travel for hunting. So what we like to talk about is each organization needs to have a flame. Sometimes the flame gets a little bit low, but we never want it to go out. But we also want those organizations that are true fire starter organizations not only keep their flame alive in their own community, but also can carry that flame throughout the country. Certainly when Shannon sits in a CEO panel, when you come to What's Right in Healthcare in Nashville and you're recognized, when you go on our website, that's truly remarkable, because over 100,000 registered people have the option of going in and reading about how you've done it. So that's truly remarkable. So you'll be on our website, you'll have this flame, you'll get a toolkit on how to publicize this locally, because sometimes in a smaller community, that external recognition goes a long, long way in telling people they don't have to travel out of the community for great health care. And of course, you'll be mentioned on our website. So thank you. It's truly an honor for Studer Group to work with you, and it's truly great to see an organization truly deliver on their mission of delivering high-quality health care to those you serve in an environment of compassion, integrity, and fiscal responsibility. And today, when people say, do you live your mission statement? You can say, yes, we do. Let me give you our results. And you know what the best result is? The type of place you're creating for your employees to work, physicians to practice medicine, and patients and family to receive care. On behalf of the Studer Group, congratulations, and thank you for setting that example.